Hi, my name is Camelia Douglas, and I'm currently in the Psychiatric Mental Health Nurse Practitioner program. And for this presentation, I chose to focus on the interventions for treatment of depression in adolescents. Depression in adolescents is a major issue, particularly for ages 12 to 17. And 11% of adolescents have a depressive order by age 18, according to the National Institute of Mental Health. In 2012, 6.3% of the U.S. population, which accounts for 1.5 million adolescents, had at least one major depressive disorder. There's also a high burden of disease, and left untreated, depression can negatively impact quality of life. The PICO question, after many revisions based on the amount of evidence available that I chose to focus on, was in adolescents with depression, under what conditions is cognitive behavioral therapy, or CBT, most effective in reducing depressive symptoms after 3 months of treatment? Keywords that I used: adolescents, depression, and cognitive behavioral therapy. 4 controlled trials were reviewed. Literature review included 4 controlled trials, and the major primary outcome measure for each of the trials was depression. Some of these studies included secondary measures such as self-esteem and attributional style, and others compared CBT to other interventions that are used to treat depression in adolescents. The first 2 studies that I reviewed, Melvin et al. And the Treatment of Adolescent Depression Team Study, also known as the TAD study, were both randomized controlled trials that compared CBT to medication therapy alone, to combination therapy, including antidepressants and CBT in combination. They were both conducted in the community and academic settings, and both resulted in combination therapy with antidepressants and cognitive behavioral therapy being superior or most effective for treating depression in adolescents. CBT alone was superior to medication alone in the Melvin et al. Study. However, in the TADS team study, medication therapy alone suggested superiority to CBT. That was thought to be attributed to the subjects having a higher level of depression, higher levels of depression. The TADS team study was also a much larger sample size, with 327 subjects versus 73 subjects for the Melvin et al. Study. In the Kearney et al. Study, which was in a school setting, I chose to seek more evidence or seek more research on online cognitive behavioral therapy or other methods of how CBT is performed. This particular online program in the Kearney et al. Study was called Mood Gym, and focused on self-paced models that these subjects could do to perform or get access to cognitive behavioral therapy. There was a greater effect on the lessening of depressive symptoms for those who completed more than 3 modules. And CBT definitely decreased depressive symptoms, but there was a lesser effect over time after the treatment. The Gall et al. Study also compares CBT to supportive therapy to education. It also explored the influence of other moderators, such as negative life events and substance abuse. And again, CBT was superior to other treatment groups, but it was more effective with lower levels of moderators, such as negative life events and substance abuse. So what can we learn from these studies, this literature review? We can determine, it has been determined, that CBT can be an effective therapy. It can be performed in school, community, and clinic settings, and it's suggested to be more effective when combined with medication therapy. Can be completed in other forms, such as online, and is definitely influenced by other moderators, such as negative life events and substance abuse. So as advanced practitioners, we can be a part of improving depressive symptoms with insight on the effectiveness of CBT. We can be advocates for issuing or being sure that it's implemented in school, community, or clinic settings, improving accessibility to services to help treat depression for adolescents. And also, we can think of help to determine alternative therapies for treating depression by using other methods such as CBT. This goes along with decreasing the risk for adolescents who take antidepressants as the historical treatment or historical therapy for depression. In the USDA issued a black box warning for the increased suicidality of patients that are adolescents who take antidepressants. So it does decrease the risk for adverse events as well.